Okay.
Okay, I'll start recording. I'm recording anyway.
I've learned from you before that you ready?
Yes.
Okay. So a couple of years ago, actually a year ago, we decided to set up a centre that was based on nutrigenomics. That we needed to actually be able to clinically implement what I'd been teaching for so many years. So we did. We set up a centre. We started using nutrigenomic testing. We got practitioners who knew what they were doing. We worked with our clients. And really what we were trying to do was trying to personalize our nutrition. We were trying to practice the most progressive nutrition we could. And that was great. Until I realized that we weren't really benefiting our customers. We really weren't changing behavior and really optimizing our treatment and our care of our patients. And I realized there were a couple of reasons to this. That we had focused on nutrigenomics, which was clearly our differentiator, but we really hadn't looked at the big picture of the practice. And so that kind of got me thinking. And what I've been thinking about is what was missing. So now I've been thinking that nutrigenomics is really just one element of a practice, one way that we can differentiate ourselves and work with our patients. Then I was thinking about functional medicine, that we need to be sure that we're practicing the paradigm fully. And because of that, we're going to be going from just a nutrition practice to a medical and nutrition practice. Then I started thinking about the model. And then, of course, I met up with James in Arizona and started thinking about this idea of a primary care model, of episodic care and program-based care, and realized that as long as we were offering a service for fee model, we would never truly change the behavior of our patient. So I started thinking how I could bring together nutrigenomics, functional medicine and nutrition, and a different way of the model. And of course, a large part of that was thinking, how do I work with functional MDs, functional nutritionists, and bring health coaching into our practice? So now what I truly believe is the future of practice for me, of functional medicine and functional nutrition in South Africa, is to try and marry these four different pillars of functional medicine practice, of nutrigenomic medicine and nutrition, of a model that is based on primary care and episodic care in terms of programs, and of bringing health coaching into the system. And one of the greatest things that occurred to me when I was thinking about this, one of the greatest changes in my paradigm shift, was what I call flattening the structure. That the most important thing I needed to do was to think about doctors in a different way. And one of the things we're going to be doing in the next couple of months is running a practice that our doctors, our dietitians, and our health coaches all work at the same level and are remunerated at exactly the same way. In that way, the value that my health coaches and my dietitians have to the patient is exactly the same that my functional medicine doctor. So in every way, we're trying to disrupt the system. In every way, we're trying to offer a different way of practicing medicine and nutrition, both at a social level, at a health coaching level, at a behavioral change level, but even within ourselves on how we work together as practitioners and the way we offer our care.